Vaginal pH is a measure of how acidic or alkaline the vaginal environment is. When estrogen is flowing, as it is during our young reproductive years, the pH stays low and acidic, usually around 3.8 to 4.5. This acidity supports healthy bacteria, protects against infections, and keeps the vaginal tissue moist and resilient. As estrogen levels drop during perimenopause and menopause, the vaginal pH starts to rise, often climbing to 5 or higher. And that change can lead to vaginal dryness, itching or burning, pain with sex, frequent urinary tract infections, and changes in discharge and odor. A pH test is not diagnostic on its own, but it's a great supportive tool. If you're experiencing vaginal or urinary symptoms and your pH is elevated, it's a strong sign that you might be dealing with what we call genitourinary syndrome of menopause, or GSM. The good news is that vaginal estrogen and hormone therapy can help reverse those changes. With treatment, your pH can actually shift back towards that healthier acidic range. With vaginal estrogen, the pH might start to improve in as little as 4 weeks, with the full benefits taking up to 12 weeks. It's gradual, but it works. Systemic HRT can also help, though the effect on pH might take a bit longer. So testing your vaginal pH at home is easy with over-the-counter strips like these. And if you're one of my patients on vaginal estrogen, I usually send you a bottle for free. So tracking the pH over time can help you see how your treatment is working, or maybe you need to make some adjustments. Now, here's where the pH is also super helpful. It can give us clues about infections. So here's a quick breakdown. A yeast infection, your pH typically stays normal or below 4.5. If you have bacterial vaginosis, the pH is typically around 5 or 6. For trichomoniasis, the pH can go anywhere from 6 to 7. And pH can even help diagnose menopause. That's right, the pH in menopause is often above 5, and that would be in the absence of any sort of infection. Now, these numbers are just guidelines, and if your pH is high and you have signs of infection, you always want to consult your medical provider. So vaginal pH is more than just a number. It's a window into your hormonal health, and it's a useful guide as to what's really going on with your symptoms. Whether you're starting HRT or using vaginal estrogen or trying to figure out if what you're feeling is hormonal or is it an infection, pH is simple, affordable, and it's a neat tool to have in your back pocket. So until next time, thanks for watching.